All right, let's jump right in. We're talking about something you probably see every single day behind the counter: nausea and vomiting of pregnancy, or NVP. It's so common, but managing it well, that's where you, the pharmacist, become absolutely essential. So, in this explainer, we're going to break down everything you need to know to handle it safely and effectively. So, to really get a sense of the scale here, just look at this number: 50 to 80%. That is a huge number. We're talking about more than half, maybe even up to 4 out of 5 pregnancies being affected by NVP. This isn't some rare thing you'll see once in a blue moon. No, this is an everyday reality for the patients walking into your pharmacy, which is exactly why your expertise is so critical. Okay, so when a patient comes to you, the very first thing you need to do, and this is probably the most important step, is triage. You've got to figure out what you're dealing with. Is this standard NVP, which you can absolutely help manage, or is it something much more serious? We're talking about hyperemesis gravidarum, or HG. This is the big red flag. It's rare, affecting less than 2% of people, but it's a true medical emergency with severe nonstop vomiting. If you suspect HG, it's an immediate referral, no questions asked. So here's how we're going to tackle this. We'll walk through it just like you would in the pharmacy. First, triage and assessment. Then we'll cover non-drug options. After that, we'll get into the medications with the treatment ladder, touch on some really important cautions, and then finish up with the key counseling points you can use right away. All right, section 1, triage and assessment. Before we can even think about treatment, we need to know exactly what we're dealing with. It's all about quantifying those symptoms, right? We need to get past "I feel sick" and get to something we can actually measure and act on. And here's a fantastic tool to help you do just that. This is the Modified Pauke's Scoring Index. It looks a bit clinical, but honestly, it's super practical. You can basically use this right at the counter. You just ask 3 simple questions. How many hours a day are you nauseous? How many times are you actually vomiting? And how many times are you retching or dry heaving? Based on their answers, you get a score, and boom, you can classify their NVP as mild, moderate, or severe. This little tool is going to be your guide for everything that comes next. Okay, on to our next section, and this one is huge: non-pharmacologic management. I'm telling you, this is the foundation. It doesn't matter if their score is mild, moderate, or severe. This is where you always start. And this is where you, as a counselor, can make a massive difference without even touching a medication. We're talking about simple, powerful dietary changes. You know, things like eating small, bland meals more often, avoiding anything super fatty or spicy that can trigger nausea, the classic crackers by the bed trick before they even get up, even things like separating when they drink and when they eat. Oh, and here's a huge one: prenatal vitamins. They're essential, but the iron in them can be a real gut-wrencher. So if a patient says their prenatal's making them sick, you can suggest they switch to just folic acid for that first trimester. That one tip can be a game changer. It's not just about food, though. You can empower them with other really effective strategies. Simple stuff, like avoiding getting overheated, trying to get more rest. We know that's easier said than done, but it helps. And then there's P6 acupressure. You can show them right on their wrist where the spot is. It's totally safe, it's free, and a lot of people find it really helps. But you know what might be the most powerful tool you have? Reassurance. Just reminding them that what they're going through is normal, and that for most people it's not hurting the baby. That can do wonders for their anxiety. Okay, so what if you've tried all that and it's just not enough? Well, that's when we move on to our next section, the pharmacologic treatment ladder. The key word here is ladder. It's all about a logical, step-by-step approach. And here's what that ladder looks like in practice. It's a really clear, evidence-based algorithm. You start at the bottom rung. For mild cases, you're looking at things like ginger or vitamin B6, which is pyridoxine. If that's not cutting it, you can move up to a combination of doxylamine and pyridoxine. Now, if you're dealing with moderate or severe NVP, that's when you bring in a first-line antihistamine like dimenhydrinate. And then only for those really tough, resistant cases do you escalate to the prescription-only stuff like metoclopramide. It's a really logical progression. Now, I have to stop here and talk about a bit of a controversy. It's about that doxylamine-pyridoxine combo, which you probably know as diclectin. For years, this was considered the gold standard, the #1 drug for NVP in Canada. But a big reevaluation in 2018, which included data that hadn't been published before, actually found it had no real benefit over a placebo. Whoa, right? So what does this mean for you in your practice? Well, it means that starting with just pyridoxine, just the vitamin B6 on its own first, is a totally reasonable, totally evidence-based way to go.
So, when things get more serious and you're in that moderate to severe category, the first line agents are typically antihistamines. We're talking about things like dimenhydrinate, diphenhydramine, the classics. Now, your number one job when dispensing these is counseling on the side effects, and the big one is sedation. You have to tell them, hey, this is probably going to make you drowsy. Managing that expectation is absolutely key.
Okay, let's move on. This next section is where your counseling skills are put to the test. We're talking about special considerations and some pretty serious cautions. Specifically, we need to talk about two things, ondansetron and cannabis. Let's start with ondansetron. And look, this is a direct quote from Health Canada. This isn't just some study. This is an official safety update from 2020. They are now officially recommending against using ondansetron in pregnancy. This came after they looked at new safety data, and it's something every pharmacist needs to be aware of. So, when that script for ondansetron hits your counter, what do? Your counseling has to be on point. You absolutely have to talk about the risks. The big one is a potential small increase in the risk of oral clefts. You also need to mention that there's some conflicting data out there about potential cardiac issues. The bottom line? This drug is really reserved for severe, resistant cases, and it should only be used after a really thorough risk versus benefit chat between the patient and their doctor. All right, now let's talk about cannabis, because this is a tricky one. We call it the cannabis paradox. A patient might think, hey, cannabis helps with nausea, so it should help with morning sickness, right? But here's the twist. For some people, especially with prenatal use, it can actually make NVP worse. It can even lead to this awful condition called cannabinoid hyperemesis syndrome, which is basically uncontrollable vomiting. So you have to ask about it, and you have to do it in a non-judgmental way. And when you do have that conversation, your message has to be crystal clear. And this isn't just an opinion. It's backed by Health Canada's official advisory. There is simply no safe amount of cannabis to use during pregnancy, period. Those cannabinoids, they cross the placenta, they get to the baby, and they're linked to some really serious stuff. Long-term brain development problems, low birth weight, preterm birth, even stillbirth. The risks are just too high.
Okay, let's bring it all home. In this last section, we're going to boil everything down to the most important, high-impact counseling points. This is your chance to really make a difference for your patients. So if you walk away with just one thing, make it these 4 points. Number 1, reassure and normalize. Let them know they're not alone and it's usually okay. Number 2, always start with lifestyle and dietary changes first. Number 3, set realistic expectations. The goal here is to make them feel better, to manage the symptoms, not necessarily to make them disappear completely. And number 4, be a detective. Always be screening for those red flags for HG and asking gently about high-risk substances like cannabis. And that brings us to one last thought to leave you with. A question, really. As a pharmacist, you are one of the most accessible healthcare providers out there. So how can we shift this whole conversation? Instead of just reacting when someone comes in already feeling awful, how can we be proactive? Think about it. What if you started this conversation when they're just picking up their very first bottle of prenatal vitamins? Could you prepare them, educate them, and maybe even lessen the severity of NVP before it really takes hold? You know, that kind of proactive care, that's really the future of what we do in pharmacy.